Today topic is Metoprolol. Subscribe our channel for more videos. Presentation outline. Uses of Metoprolol. Action of Metoprolol. Administration alert. Pharmacokinetics. Adverse effects. Contraindications. Interactions. Treatment of overdose. Actions and uses. Metoprolol is a selective beta-1 adrenergic blocker available in tablet, sustained-release tablet, and IV forms. At higher doses, it may also affect beta-2 receptors in bronchial smooth muscle. The drug acts by reducing sympathetic stimulation of the heart, thus decreasing cardiac workload. Metoprolol has been found to slow the progression of HF and significantly reduce the long-term consequences of the disease. It is usually combined with other HF drugs such as ACE inhibitors. Metoprolol is also approved for angina, HTN, and for reducing cardiac complications following an MI. Administration alerts. During IV administration, monitor the ECG, blood pressure, and pulse frequently. Assess the pulse and blood pressure before oral administration. Hold if the pulse is below 60 beats per minute or if the patient is hypotensive. Advise the patient not to crush or chew sustained-release tablets. Safety and efficacy in children under age 6 have not been established. Doses should be reduced for elderly patients because they are at risk for dizziness and falls. Pregnancy Category C. Pharmacokinetics. Per oral. Onset. 10-15 minutes. Peak. 1-2 hours. Duration, not applicable. Per oral. Extended release. Onset, not available. Peak, 6-12 hours. Duration, not applicable. IV. Onset. Immediate. Peak. 20 minute. Duration, not applicable. Therapeutic class, drug for heart failure and HTN. Pharmacologic class, beta-adrenergic blocker. Well absorbed from GI tract. Protein binding, 12%. Widely distributed. Metabolized in liver. Primarily excreted in urine. Removed by hemodialysis. Half-life, 3 to 7 hours. Adverse effects. Because it is selective for blocking beta-1 receptors in the heart, Metoprolol has few adverse effects on other autonomic targets and thus is preferred over non-selective beta blockers such as propranolol for patients with respiratory disorders. Adverse effects are generally minor and relate to its autonomic activity, such as slowing of the heart rate and hypotension. Because of its multiple effects on the heart, patients with heart failure should be carefully monitored. Other frequent adverse effects include abnormal sexual function, drowsiness, fatigue, and insomnia. Contraindications. This drug is contraindicated in patients with asthma, cardiogenic shock, sinus bradycardia, heart block greater than first degree, and overt cardiac failure. Interactions. Drug-drug, concurrent use with digoxin may result in bradycardia. Oral contraceptives may cause increased metoprolol effects. Use with alcohol or antihypertensives may result in additive hypotension. Metoprolol may enhance the hypoglycemic effects of insulin and oral hypoglycemic drugs. Lab tests. Metoprolol may increase values for the following: uric acid, lipids, potassium, bilirubin, alkaline phosphatase, creatinine, and antinuclear antibody. Herbal food, unknown. Treatment of overdose. Atropine or isoproterenol can be used to reverse bradycardia caused by metoprolol overdose. Hypotension may be reversed by a vasopressor such as parenteral dopamine or dobutamine. Thanks for watching. Subscribe our channel.